Welcome to the New York Medicaid EHR Incentive Program Post-Payment Audit Education Series. The topic for this tutorial is completing the Medicaid patient volume spreadsheet. This tutorial serves as a guide for eligible hospitals and eligible professionals participating in the New York Medicaid EHR Incentive Program who are preparing for an audit of their Adopt, Implement, or Upgrade AIU or Meaningful Use MU activity. The intended audience includes providers, designated representatives, office administrators, vendors, and any individuals assisting in the audit process. The tutorial will step you through completing the Medicaid patient volume spreadsheet. You can pause, rewind, and fast forward as needed. Keep in mind as you view the tutorials in this education series, the Office of the Medicaid Inspector General, or OMIG, is the organization that oversees post-payment audits for the New York Medicaid EHR Incentive Program. The Department of Health, or DOH, is the organization that administers the prepayment process. The two entities are independent of each other. OMIG auditors may ask for additional documentation that is not asked for in prepayment. Let's begin. The Medicaid patient volume spreadsheet is a Microsoft Excel form. As a reminder, at the time that the provider completed their AIU or MU attestation, he or she attested to having a Medicaid patient volume that was at least 30%, or 20% for pediatricians. The purpose of this spreadsheet is to document all of the provider's Medicaid and non-Medicaid encounters during his or her Medicaid patient volume reporting period to ensure that the percentage attested to is accurate. The first step to completing this spreadsheet is to enter the provider's name as it appears in the MyPass system. If you are unsure where to find this information, you can access the educational resources available on the EHR Incentive Program website for more information on navigating the MyPass system. Next, select Tab or use your mouse to move to column E. Enter the provider's NPI as it appears in the MyPass system. The next step is to navigate to the next row and enter the start date and end date for the Medicaid patient volume reporting period that the provider entered on his or her attestation in MyPass. Providers will have attested to a 90-day consecutive reporting period that took place in either the previous calendar year or 12 months before the date of attestation. The reporting period must be entered in the format month/day/year. For more information on reporting periods, visit the New York Medicaid EHR Incentive Program website tutorials page and view the video entitled Understanding Reporting Periods. Next, navigate to column A and enter the date of the first patient encounter. Please note that the encounter date is not the date payment was authorized or received, but the actual date the patient was seen by the provider. Ensure that the encounter date is within the Medicaid patient volume reporting period and is in the format month/day/year. OMIG auditors will not count an encounter if the date is before or after the patient volume reporting period. OMIG auditors will also not accept encounter dates if the format does not follow month/day/year. If the encounter totals on this spreadsheet differ from the data on the provider's MyPass attestation, the auditor may request more information. Your next step will be to navigate to column B and enter the NPI that rendered services, meaning the provider that actually saw or treated the patient on the encounter date. Please note column B could include multiple NPIs if the provider attested to group patient volume, in which case include all NPIs that rendered services during the patient volume reporting period for the group. For more questions on this, contact the auditor. In column C, enter the NPI that billed for the services listed in column B. The purpose of column C is to indicate to the auditor if the services rendered were billed under another NPI or multiple NPIs. For any questions, contact the auditor. Click Tab to navigate to column D and indicate if the encounter is a Medicaid or non-Medicaid encounter. Encounters cannot be labeled as both Medicaid and non-Medicaid. Medicaid encounters include both Medicaid fee-for-service and Medicaid managed care. For the definition of a Medicaid encounter, please reference FAQ EP07. Click Tab to navigate to column E and enter the patient's Medicaid identification number, also known as a CIN. A CIN consists of 2 letters, 5 numbers, and 1 letter. For non-Medicaid encounters, leave this field blank. It is not necessary to list the non-Medicaid insurance ID number. In the next column, enter the patient's first and last name as it appears on his or her managed care insurance ID or common benefit information card. For example, if a patient's name is listed on the card as Jennifer Green, be sure to type Jennifer Green and not Jenny or Jen. First and last names must be entered in separate columns, first name in column F and last name in column G. Next, enter the patient's date of birth in column H. Pay close attention to ensure that the date of birth is entered correctly. OMIG auditors will not count an encounter if the date of birth is after the patient volume reporting period. Additionally, OMIG auditors will not count encounters if the date of birth is not in the format month/day/year. Repeat these steps until you've entered the data of all patient encounters during the reporting period. As you're completing the workbook, here are some things to keep in mind. If you cannot obtain patient volume, did you attempt to contact your billing company? If you cannot obtain your patient volume, can you support a different 90-day consecutive reporting period that took place in either the previous calendar year or 12 months before the date of attestation? If you're unable to support the Medicaid patient volume requirement, the incentive payment will be recouped. All data submitted must come from an auditable data source. The auditor may ask for additional documentation to support the submitted data. Congratulations, you've completed the EHR Incentive Program Post-Payment Audit Education Series tutorial, completing the Medicaid Patient Volume Spreadsheet. If you have additional questions about your audit, please contact the assigned auditor. Thank you for viewing this tutorial. You can view additional educational resources by visiting health.ny.gov/EHR.